Euro-Pēds was founded in 1999 to work with children who had cerebral palsy and other neuromuscular disorders using a new intensive therapy model. It was the first clinic of its kind in North America and today has treated over 1,300 children and young adults.
My son, Ben, has cerebral palsy. He's 14 years old. And this is our 18th visit at Euro-Pēds. So we really started when I think he was 3.5 or 4 years old. It's a process, and it isn't just for 2 years, and it isn't just for 5 years.
Euro-Pēds was creating more mobility and better outcomes for children. Yet health insurance plans were not always covering this emerging therapy. With the belief that every child deserves a first step, the Euro-Pēds Foundation emerged in 2013 as a non-profit organization dedicated to supporting children with gross motor disorders and their families.
We find that Euro-Pēds is the most effective rehabilitation because of its intensity and day after day after day repeated practice. We've been visiting Shelly when we come. You would think she's family for how many days in advance he counts down until it's Shelly Day. She's a cheerleader, she's a motivator, she's enthusiastic, and he feels that if you're going to be here for 4 hours, you might as well love it, and he does.
The goal of Euro-Pēds intensive physical therapy is to take the child to their full potential with intense bouts of individualized therapy sessions. Like an athlete, the more practice and strength gained in a short period of time, the more the brain learns a new skill, and the body has the strength to carry it out.
In the years I had a lot of surgeries, but your muscles are so weak after the surgery. You get 2 steps back and then 3 steps forward because of the therapy.
An intensive physical therapy session is proactive, up to 20 hours per week, while traditional physical therapy is normally only 1 hour per week. The extra time allows therapists to use specialized equipment, like the Euro-Pēds therapy suit and the Universal Exercise Unit, also known as the cage.
We see just drastic changes with these kids, and that's different for every child and with what level they're coming to us, but they all go to a new place while they're with us, whether that's rolling over or sitting up or taking that first step, but they're making much bigger changes with us than they might be seeing with their traditional models, just because of that intensity that this model provides.
And when he returned to school, I remember after that visit, went to the 3rd grade classroom, walked all the way from the back of the room up to the front and put his attendance stick into the pocket, and his aides were just crying. It still makes me cry today. It was such a dream that we never thought would come true.
Financial support is still needed for many underinsured or uninsured patients. While many of these families fundraise on their own, the Euro-Pēds Foundation will provide grants in 3 ways. General treatment grants for children who may benefit from an intensive PT session at Euro-Pēds, grants to a specific child, and travel grants for out-of-state families. Board members are all dedicated volunteers so that donations to the Euro-Pēds Foundation can be maximized to help the children and their families.
Even if their insurance is covering the cost, there's the travel, there's the hotel, there's still a lot of out-of-pocket expenses that are incurred, when they're traveling for therapy. It would be really exciting to our families who've been coming and to families who are waiting to come to hear that we have, a program like that to help them.
If you are someone who believes passionately that children with motor disabilities deserve a chance, the EPF is the perfect opportunity to make a difference by volunteering or considering the EPF for a tax-deductible donation. Thank you for recognizing that every child deserves a first step.